Hi, everybody. This is David D'Arcangelo, Global Marketing Director at CTFO. I have a member of the CTFO Medical Advisory Team, Dr. Phillip Zinni, on with me today. Welcome, Dr. Zinni.
Howdy.
For those who don't know, you're currently the physician for the largest gaming casino and the past largest winery, the Eldorado Resort. And what I always like to pick up about your background is people who focus on sports medicine, and your sports medicine fellowship from the American Osteopathic Academy of Sports Medicine, and you were past president and have been in the practice for 29 years. You've been around since we launched XanthoMyst. You were around before that, but the medical advisory board at CTFO. We've had 5 months. You've had 5 months. With your background, it's been under your professional observation. How do you measure XanthoMyst success?
So the typical way is looking at symptoms. Are symptoms improving, getting better, changing? But the telltale sign is laboratory tests, and some are kind of conventional, which any physician or advanced practice provider would order. And then others are more on the functional side, looking at root causes of issues that could be extrapolated into larger problems. So it's looking at all those, and I can talk about that a little bit later on.
Yeah, let's talk about the success in your practice, XanthoMyst, treating patients, some
Mhm.
experiences that you can, and you're not giving medical advice or any way, so we make that really clear for people. But I assume that's where the rubber meets the road, is you seeing real results.
Exactly. And again, this is from not only clinical practice, consulting people, but I'm also blessed to mentor a diabetes group. And these are people that want to get off their medications and want to improve their health without medications. And I've been doing that for over 2 years now. So it's been shepherding those people and using the XanthoMyst. So the first one, and I'm just gonna just the way my mind is wired, I'm
Yes.
gonna go by age. So the youngest is a 45-year-old Hispanic female who have been using XanthoMyst for a while, and then on her own, she was having this urticaria is just a fancy word for kind of an itchy kind of lesion on the skin. So on her own, she decided to spray XanthoMyst on it.
Yeah.
And within a couple of days, it completely went away. So
Wow.
you're thinking, how did that happen?
Yeah.
So then when I look at what XanthoMyst does, how it helps out with inflammation, how it helps to modulate the immune system, when you think about skin lesions, especially ones that are kind of itchy, those are usually somehow related to the immune system that's gone awry.
Right.
So it makes perfect sense that a topical delivery system, especially with that nano-emulsion system, it's going to penetrate through, it is going to help out tremendously in that kind of aspect,
Right.
which completely blew me away. I wasn't thinking
Yeah.
about
Yeah. That's fantastic when it you see something on your skin. It's a lesion. You missed it, and you ever notice if you just put some of that mist on there and then you rub it a little bit, it just goes in.
exactly.
It's so amazing. And then to see it heal, I've fell on my mountain bike or something and scarred my legs, and and I'm doing the same thing. I'm just misting it, rubbing it, and it disappears. So yeah, so take us to the next phase.
Yeah.
You know, 45-year-old, inflammation, joint pain, any of those cases?
Yeah, so the next one is another individual from this diabetic group that has joint pain. And part of the joint pain is from weight-related issue, musculoskeletal issues. Part of it is from the diabetes. But over time, she noticed that her knee pain got better. She was able to walk around better. Also, her A1C, that's just a fancy word for measuring your blood sugar over a 90-day period, that got better. And she was able to drop her insulin. So instead of using 100 or more units a day, she was able to drop that down to, I think she said 40 or 50. So about a 50% reduction in her insulin. And that was just a short period of time.
Oh,
So
yeah.
again, you have to ask yourself, how does this happen? And it's from the inflammation, the fact that it's an anti-inflammatory, the fact that it helps to modulate or help modify the immune system. But more importantly, for the diabetics, it helps with decreasing insulin resistance, which means that whatever insulin you have floating around, or in this case, the insulin she was giving herself, is more effective. And then the really exciting thing is that it induces this what we call caloric wasting, which means that the cell kind of forgets to think about the glucose or the sugar that's in the body. So it's kind of like a non-surgical gastric bypass where the body is not looking at sugar. It's
That is
wasting.
just an amazing thing to say. And it's a little blurry because of my background, but it's just like, wow, from that bottle, that mister. So
Yeah,
yeah,
yeah.
amazing. So speaking about that is, I know you've had success and weight management is a
Mhm.
side benefit.
Exactly.
Yeah,
Exactly. And part of it is because of that caloric wasting phenomenon that this induces. The other thing that it helps, and this is what we're learning more and more, is that the gut helps to kind of modulate everything. I mean, if
right.
you think about it, from your mouth to the other end is an open tube, and the only way that anything interacts is if it gets through that lining. So if that lining is damaged, hence the term leaky gut, then abnormal things get through, and those abnormal things are viewed as aliens or the enemy or an attacker, and the immune system just goes off the charts and gets hyperactive. So anything that we can do to reduce that helps out. So that's why the leaky gut phenomenon helps the body to heal itself if we can correct that. And by doing that, you're
Wow.
inadvertently going to be reducing weight because you're going to be giving your body better foods that your body can use. So it's all wrapped together, and that's why we look for the root cause of things as opposed to just looking at, well, they're overweight. You know, how did it get there?
Right. It's as a doctor, you're treating patients, and we're talking about your experiences now, real life experiences. It how often does a product come to you like a XanthoMyst that you've ever had this much success, or your patients have had this much success, and you treating them?
Yeah, so that's the beautiful thing is that I'm always on the lookout for something that's I hate the word disruptive, but it's
Yeah.
an apt word. Something that disrupts the usual flow of things, and something that is going to be a life changer. And that's what this is. And it is for several reasons because of the delivery system with the 10x Pure, with the fact that it's nanoemulsed, so this way it's absorbed easily, and the fact that it's so concentrated. So this way, you're not drinking quarts or gallons of something else that has mangosteen in it. You've got one travel sized bottle that you can carry with you anywhere in the world,
Yeah. Yeah.
literally.
Yeah, it's the delivery is amazing, and everybody that we see from various professions who really know the industry, they've done sprays, they have done capsules, they've done powders, and then they look at our mister and they just go, wow. And and then you twist it to miss, so it just has that, like, wow, this is good. It's all right here.
Exactly.
So,
Exactly.
so does age make a difference as you go up? Say somebody in their 70s have a different experience than somebody in their 30s?
So, what I'm kind of finding out is that if you could get the body kind of saturated.
Mhm.
And the classic example is whenever we recommend vitamin C for someone, we tell them to load. And this is so that the body can get the maximum dose effect. And then you can saturate all the tissue, and then you go on to a maintenance level. So it's classic in the pharmaceutical world, and even with vitamins and specifically vitamin C, it's classic that you need to load. So I'm seeing that with the XanthoMyst, that if we could load the body beforehand and then go to the maintenance, people will see a lot quicker results, and as a result, will feel a lot better about the product, as opposed to someone that has to wait 3 months for that A1C, because it takes 3 months for the blood cell to turn over. So you have to wait 3 months to see a lab result, whereas you can start feeling results quicker by loading with the XanthoMyst.
Yeah, that's interesting. We're doing some testing right now, as you know, and on the loading phase and then the maintenance phase, and it's really the group of people that we chose were a group of people who weren't just happy, healthy, and then you load but also had some really serious issues,
Mhm.
so that we can see how it impacts, the issues that they have, and obviously for the better. So we're working on that right now. Is there anything you'd like to say to the audience before people listening, watching? These are real life experiences from your practice. You're not giving medical advice. And everybody else, when you have a health issue, you should consult your physician. But just any advice for any of the people listening before we leave?
Yeah, so everything that I recommend, I also personally do. We never had a chance to talk about everything else that I take,
Yeah.
including my cat. So I'm a walking product in order to make sure that what we say is actually happening and occurring in the body. So everything is either professionally seen in my consultations and practice, or personally with myself, my wife, and my cat.
Wow, that's beautiful. So, XanthoMyst is, would you say it's from the outside world of coming into your practice? I would assume it's one of the top three that you've seen and used and worked with, that hasn't come down that drug delivery pipeline from the pharmaceutical world, but outside in the natural world.
Yeah, because of the delivery system and the fact that it's so bioavailable and it is so convenient.
Yeah.
Those are all game changers. And that's happened within months for a product that's been around for decades, which is truly remarkable.
Yeah. Thousands of years. It's helped millions of people. I've never seen a product like this that the history of it has gone on and on and on. You can't fool everybody forever. And this one is just the cream rises to the top. So we thank you for being here today. Everybody else, the testimonials are really where the rubber meets the road, and we appreciate you as a member of the CTFO Advisory Board and look forward to talking with you soon.
Good deal. Thank you. Pleasure
Thank
to.
you.
Bye bye.